Today I wanted to speak a little about anorectal malformations. It's a big topic, so I just wanted to touch on a few aspects today. To start with, I wanted to talk about what we look at when a patient comes to see us after having had a PSOL. What do we look at and why do we do it? We look at the reconstruction of the rectum and how it's placed within both the pelvic floor and the sphincter muscles. We think this is really important to give children the best chance of attaining continence. Traditionally, we've used pelvic MRI and an examination under anesthetic for this purpose. However, when we studied the results, we found that the MRI was largely unhelpful. More recently, we've been using three-dimensional anorectal manometry and are very excited about the results so far. So what do we do if we find the anatomy of the reconstructed anus can be improved upon? Well, honestly, one has to look at the whole patient, but in some circumstances, we would offer redo surgery for those patients. We recently looked back at all the patients who had been assessed here in Columbus at the Center for Colorectal and Pelvic Reconstruction and published our findings in the Journal of Pediatric Surgery. We assessed 600 patients referred to us with incontinence during the study. Of those 600 patients, 150 were offered reoperations. So why were those patients offered redos and how did they do? Well, we only offered redos to patients who have a significant problem with their anatomy, which we believe we can improve upon with surgery. For the patients with a well-developed sacrum and a normal spine, around 75% or 3/4 were able to successfully potty train after their redo. Surprisingly, even some patients with less well-developed anatomy were also able to potty train. So we were able to show a benefit in terms of continence and quality of life. However, this always has to be balanced with the risks of complication. We did most of these surgeries without a stoma, and we didn't do any anal dilations post-operatively. Around 5% of patients had a wound issue which needed surgery, and around a third needed a day case procedure, a Heineke-Mikulicz anoplasty to deal with scarring at skin level. We believe these data can help parents to make more balanced and informed decisions regarding the risks and benefits of further surgery on their children. It also underscores the importance of getting the anatomy right during the reconstructive operation in order to avoid the need for further surgery.